Good morning, everyone. Welcome to the COVID-19 vaccines and the new normal webinar. I am Anderson Shum from the Department of Mechanical Engineering at the University of Hong Kong, also a founding member of the Hong Kong Young Academy of Sciences. It is my great honor today to be your moderator for this special webinar event, which is held jointly by the Hong Kong Young Academy of Sciences, the Hong Kong Academy for Gifted Education, as well as the Hong Kong Young Industrialist Council. COVID-19 has affected everyone's lives in the world since last year. The vaccination process has started in Hong Kong, but the public has still many questions concerning the vaccines. We are most honored to have three speakers and experts in the fields of bioengineering and public health to share their views with us on the COVID-19 vaccines and the new normal, and answer your questions as well. They are Professor Angela Wu, Professor Leo Poon, and Professor Benjamin Cowling. Professor Wu is from the Department of Chemical and Biological Engineering, and also the Division of Life Science at the Hong Kong University of Science and Technology. Professor Poon and Professor Cowling are from the School of Public Health, Faculty of Medicine at the University of Hong Kong. Both Professor Poon and Professor Cowling are founding members of the Hong Kong Young Academy of Sciences. Professor Wu and Professor Cowling will speak in English, and Professor Leo Poon will speak in Cantonese. After the sharing by the three experts, we'll take questions from the audience. So if you are joining us today through Zoom, feel free to send your questions to the host in the name of Q&A through the chat box in the Zoom. I will ask the questions for you in the Q&A section. 歡迎大家參與2019年冠狀病毒疫苗與新常態網絡研討會。今日呢一個網絡研討會係由香港青年科學院、香港資優教育學院同埋香港青年工業家協會聯合舉辦。我哋今日好高興可以請到三位分別嚟自香港科技大學嘅吳若昊教授、香港大學嘅潘烈文教授同埋 Benjamin Cowling 教授同我哋分享。吳教授同埋 Professor Cowling 會用英語分享，而中間分享嘅潘烈文教授就會用廣東話分享。我哋現在有請吳教授。So may I now first invite Professor Angela Wu to speak. Professor Wu, please. 有請吳教授。
Hello, thank you, Anderson, for your nice introduction. Hello, everyone. My name is Angela Wu, and I am here today to first share with you some of the background knowledge about viruses and also how vaccines really work. So let me start by sharing my slides. Please let me know if you're able to see my slides. Is that, Anderson, could you tell me if you can see my slides okay?
Okay.
Okay, great. So I will begin. So as you can see, my title is How Vaccines Work, or To Recognize and Kill a Zombie. And I'd like to use this example of the zombie to help you remember how a virus enters our body and infects us, and then how the vaccine is a good way to help us recognize and destroy the virus. So let me start with some very basic biology to help everyone understand the information that's to come later. Actually, all biological organisms will use a certain pipeline to create their biological functions and to be able to function as normal. The blueprint of all biological organisms is either DNA or RNA. For humans, it is DNA. And this is the blueprint of all biological instruction for the living organism. It's like a cookbook that you want to make a recipe item from. And then in the cookbook, there are many different recipes. And this is what we can think of as the RNA. The DNA needs to be converted first to RNA before it can be converted into protein, which is the actual functional molecule that does the biological functions in the biological organism. So this pipeline, as I mentioned, is used by all biological organisms, including viruses, even though viruses are non-living organisms. The virus looks like this. It's like a ball with some yarn packaged inside. And actually the package inside is their genetic material, which is either in the form of DNA or RNA. And the outside is a protein shell. What's important to know about the virus is that the virus cannot grow or reproduce on its own, and it cannot make energy. It can only survive by using the machinery of its host cell. That's why we consider the virus non-living organism. So you can imagine that if a virus sits on a surface like a tabletop for a long time without being in a host, the virus actually becomes inactive. This is why if we want to sterilize the surfaces, to destroy the viruses, we can spray the surface with alcohol to disinfect, and then the virus, if it stays there for long enough, it will become inactive. So as I mentioned, the virus has to depend on the infected host to multiply itself. This is the basic action of a virus. So when the virus finds a cell that is compatible with it, it will attach to the surface of that cell and then enter into the cell. And in the cell, it will use the host system to multiply, meaning that it will turn its DNA genetic information into RNA and then into the viral proteins. And the viral proteins and its genetic material will then be packaged into new viruses, millions of them, inside this host cell, finally being released into the environment. And these new viral particles will then go to the surrounding cells and infect more cells. So this is what happens when we get infected with a virus. A few cells at first will get infected, but these cells will become hacked to make more virus and more cells get infected until we get sick. Now, coming to the SARS-CoV-2, which is the virus that causes the disease COVID-19. The SARS-CoV-2 is a coronavirus. That's the classification that we give it. It comes from this family of viruses. And actually, there are many viruses that fall under this category of coronavirus, including some common cold-causing viruses, also the 2003 SARS-CoV-1, which is the SARS virus, and also the MERS virus. These are all considered the category of coronavirus. You can see that it's called coronavirus because when you take an image of this virus, it looks kind of like a crown because it has these protrusions on the surface of the virus. These are proteins on the outside of the virus, and this particular protein, the S protein, what we call the S protein, this is a very important protein. It is called the spike protein because it's spiky, and sometimes we just call it S. This S protein is what allows the virus to enter and infect our cells. And if this S virus changes, then the way that the virus can enter the cell and the different types of cells that it can enter may also change. And also, when we talk about mutations to the virus that cause these new strains that are perhaps a little bit more deadly or more infectious, usually it is the S protein that has become different from before. So now I have given you an overview of what happens when the virus infects a cell. Basically, our infected cells become zombie cells. You have initially a viral infection that comes into the body. These viruses will infect the host cells, and these host cells become zombies that can then attack other host cells, infecting more and more cells, and that's how we become very sick. So how do we destroy these zombies? How does our body handle these zombies that will keep spreading if we don't do anything? Well, that's why we have an immune system. Otherwise, all of us would have been dead a long time ago. Our immune system is the defensive army of our body, and it's made up of many, many kinds of different cells. And these different immune cells, as pictured here, can recognize self versus foreign proteins, or DNA and RNA. So pathogens, including bacteria and viruses, can be recognized by these cells as foreign and then destroyed by these cells. Two important players in this system include the T cells, which are pictured here. These T cells, including killer T cells and helper T cells, these killer T cells will actually recognize those zombie cells that have been infected with the virus to kill them because they don't want these infected zombies to keep biting the other cells and infecting the other cells. And the way that these T cells recognize which cells are infected is those infected cells, like you saw in the cartoon, they will have pieces of the virus on their head, on their surface. And actually, when the T cells look at these foreign pathogen pieces from the virus, they can recognize that these cells are infected and need to go. However, these T cells, these killer T cells, before they can do their job of killing infected zombies, they require activation from the helper T cells and dendritic cells. These are other immune cells in the body that will also swim around and surveil for the infected cells. But once the T cells are activated, then they can do their job very swiftly. Another important member of this immune army is the B cell. So B cells are pictured here. You can see there's a Y-shaped protrusion here. These are actually similar to antibodies. When we talk about neutralizing antibodies that can kill the virus, this is similar to the neutralizing antibody. These T cells can also present pieces of the foreign pathogen, including the spike protein from the COVID-19 virus. They can present these pieces to the killer T cells to help activate the T cells. But one other very important function that B cells have is to produce antibodies, as I just mentioned. These antibodies are really awesome and they're really important. They can be thrown out into the blood to neutralize or block the activity of bacteria and viruses, meaning that if there are new viruses being produced by the infected zombie cells, those viruses that come out can be neutralized by the antibodies. These antibodies can also glue together many of the viruses or bacteria into a large clump so that other immune cells can recognize them as bad and eat them. And they can also stick to infected cells or stick to the surface of bacteria and viruses and explode them, basically destroying them or blowing them up. So these antibodies are very important and they are produced by the B cells. So the T cells and B cells play a very important role in the immune system, but as you can see, they need help from other cells and they need to recognize something as foreign or bad. So this recognition, of course, can happen naturally, but if we have such a strong immune system in our body, how can we still get sick, right? We still get sick sometimes from other, colds or from COVID-19, we're getting sick. So are these cells not doing their job? Well, the problem is that the first time that our bodies encounter a pathogen, like SARS-CoV-2 or the COVID-19 virus, the immune system has not seen it before. The T cell and the B cell have never seen this virus before. And so it takes them some time to mount a defense. Just like we have lots and lots of different types of zombies, we may not immediately recognize a zombie as a zombie the first time you have ever seen one. So this is why a vaccine can help. The vaccine introduces an inactivated or weakened form of the virus or bacteria into the body such that their pieces can be picked up by our immune system. And once our immune system have seen the virus once, then these activated helper T cells and B cells can remember what the zombie looks like. And the second time that this same virus or bacteria attacks or enters your body, the immune system can respond very, very quickly. So the production of antibodies by B cells and some memory B cells will remember the virus and stay around in your body when the next attack comes. And same with those T cells. So I want to play this short video clip from the Game of Thrones to kind of give you a more vivid memory of what it might seem like, an analogy of what it's like to have a vaccine.
We have something to show you. We can destroy them by burning them. We can destroy them with dragon glass. If we don't win this fight, then that is the fate of every person in the world.
So why do I show this video? Some of you who have seen Game of Thrones before may remember that initially the queen and the rest of the people did not believe that this type of zombie existed. And so they would not mount an army to go and attack the zombies. So Jon Snow had to bring a sample of the zombie in front of them to show them that it is real. And this is exactly what a vaccine is like. The vaccine shows you what the zombie is like. And just like Jon Snow said, he can tell them how exactly to kill it. You can kill it with fire, or you can kill it with dragon glass. So this is how vaccines work, to stimulate the immune system such that the next time it sees this creature, it knows exactly how to deal with them. Oops. So let me now talk about the exact types of vaccines that we have purchased or have planned to purchase in Hong Kong, and tell you about the differences between them. The first one I would like to introduce is the type of vaccine called inactivated virus vaccine. So this kind of inactivated virus vaccine starts with live bacteria or live virus, in this case, the live SARS-CoV-2 virus, that is produced by cells inside a lab in a dish. Then we purify just the viruses, the viral particles, and we kill them, or we inactivate the virus using either chemicals or heat. So once these viruses are inactivated, they can no longer infect the cells, but they still contain the protein pieces on the surface, such as those spike protein, and the immune system can still recognize them when they're injected into the body. So if you get this coronavac vaccine, this is an inactivated virus vaccine. This type of vaccine, when you get the vaccine, on the bottle or in the package, you might see varicocele and wonder, oh, what is this varicocele? This varicocele is an African green monkey kidney cell that we produce in the lab. We can grow them in large quantities in the lab. And these are the cells that laboratory technicians will infect with the SARS-CoV-2 virus to produce more of the virus to make the vaccine. In this particular vaccine, we will use a chemical to inactivate the virus and keep the viral proteins still intact. Then we'll add some additional additives, preservatives, and other things to make the vaccine more effective before making it into a form that is injectable into the muscle. Once the viral protein, which is now inactive, enters the muscle cells, then the B cells and T cells will respond to the dead virus and producing that immune memory that I mentioned just now. So this type of technology is a conventional, mature vaccine technology, meaning that it has been around for some form or another for around 70 years or so, perhaps even more. And that technology has been improving over time to become much safer and more effective than before. And so this type of vaccine is considered quite safe, and the production method is well established. So it can be produced in large quantities very, very quickly. The second type of vaccine, which is currently, until recently still available in Hong Kong, is the mRNA vaccine. So this type of mRNA vaccine, you may remember to my very first slide, RNA is the intermediate between the DNA, which is the genetic information, and the protein, which is the actual functional biological product. So how does this vaccine work? It starts by looking at the DNA, the genetic material of the virus itself. And as I mentioned, the spike protein on the surface has to be encoded by the genetic material of the virus. So once we know the genetic code that encodes for the spike protein, we can manufacture the mRNA that represents the spike protein. Then we package this mRNA into the so-called lipid nanoparticle. The lipid nanoparticle is a small fat droplet that acts as a cargo box. And this cargo box containing the viral material is injected into the muscle of your arm in the vaccine, and it will go into the muscle cells or other immune cells that come into contact with it. Once the cell receives this mRNA message from the virus, it will produce the viral protein and present it on the surface. Now, these cells are not actually infected because, as you can see, no active virus ever is introduced into the cell. Only the part that the cell knows how to make the viral protein from. So once it presents this viral protein on the cell surface, then the T cells and the B cells can also recognize this foreign protein from the virus and gain the immune memory. In this case, sometimes the T cells and B cells may mistakenly think that this cell is infected, even though it is not infected, and destroy the cell and kill the cell. This is why in some cases, people may report a stronger reaction to the mRNA vaccine than the inactivated vaccine. But it is still has been demonstrated in studies to be safe and for most healthy individuals. And finally, the third kind of vaccine, which has been discussed in the news, but has not yet been available in Hong Kong, is a type called viral vector vaccine. This kind of vaccine has been developed by Oxford and AstraZeneca. And this type of vaccine is a little bit similar to the mRNA vaccine in that it is packaging a DNA of the viral protein rather than an RNA of the viral protein. This is put into a harmless virus shell, which we call the viral vector. And this harmless virus shell acts as the cargo box that delivers the virus DNA into the cell. The cargo box that is used in this particular vaccine is called ChAdOx1. And this virus is the shell of a chimpanzee adenovirus. The reason why we use this is because a chimpanzee viral vector or the virus shell from this chimpanzee virus does not naturally harm the human cells. And there's no strong chance of it eliciting some dangerous reaction inside the human body. So same as the mRNA vaccine, once this DNA encoded for encoding the viral protein enters into the body, the cells that receive this cargo box will begin to make the viral protein on its surface. And again, the T cells and B cells will recognize this viral protein and form immune memory. Again, these cells may think that they're infected, but actually they are not infected and it will not make you sick. And also, of course, it cannot spread the virus more, as in the case of a real infection. This particular viral vector vaccine has been planned to be purchased by the Hong Kong government, but it is not yet approved by the medical authorities. That's why it's not yet available for injection. So overall, what is the difference between these three types of vaccines? You can see that the mRNA vaccine, the number of doses you have to take is 2. However, the main difference that we want to pay attention to is that the storage condition is quite difficult. It needs to be stored at a very low temperature and can only be stored for up to 5 days. Whereas for both of the other types of virus, either the inactivated viral vaccine or the viral vector vaccine, both of these can be stored at a regular refrigerator temperature for a much longer amount of time. Also, this Oxford AstraZeneca viral vector vaccine can be injected in a single dose, and so it may be more convenient in certain places. You can see that for these two types of vaccines, there have been other vaccines previously against other diseases that have been developed, including for whooping cough and rabies and Ebola. The mRNA vaccine technology is very, very new, and it was kind of accelerated technology development to fight the COVID-19. If you would like more information about the vaccines, and if you have some questions other than asking us later in the Q&A, you can also check out this link, which at covidvaccine.gov.hk for additional resources. These resources are all very, very helpful if you would like to understand more about the vaccine. So hopefully I've given you an idea of the biology behind the COVID-19 virus and its infection, and also how vaccines can help us to fight the COVID-19 pandemic. If you have further questions, I will be happy to take them during the Q&A. Back to you, Anderson.
Thank you, Angela. So to the audience, if you are joining us today through Zoom, feel free to send your questions to the host in the name of Q&A through the chat box in Zoom. I will ask the questions for you in the Q&A section later. So now may I invite Professor Leo Poon to speak. He will speak in Cantonese. 吳教授嘅分享之後，我哋有潘烈文教授，佢會以廣東話去分享。我哋而家有請潘教授。
Right, can you hear me well?
Yes, Leo.
Right, okay. So I'm going to speak in Cantonese, but if you have questions, please feel free to write it down in the chat box, and we can discuss about it later on. So 你哋好咁而家我咧將會咧就講一講咧我哋呢個新冠嘅疫苗咧喺香港，或者我哋講緊點樣研發， 嘅過程究竟係點樣？跟住之後我哋會再講下究竟佢嘅實際嘅保護作用啦，同埋佢究竟咧喺唔同嘅國家裏邊咧係用過邊個地方用過嘅。嗱咁其實嗰個新冠肺炎就喺2019年嘅12月啦，就開始有呢個出現咗一個30號有講呢個係有呢個喺武漢裏邊咧係有一個爆發嘅出現。咁樣就喺好早1月嘅時候咧，就20年1月嘅時候咧，就世衛咧已經係多次咧去睇下究竟呢件嘅事件咧係咪一個國際關注嘅突發公共衛生事件。咁喺呢個1月30號嘅時候，喺第2次嘅會議當中嘅時候咧，就世衛咧就已經咧係確認咗呢個嘅新冠嘅肺炎咧喺武漢嘅爆發嘅時候咧係一個國際關注嘅突發公共事件。咁其實呢個好有一個特別嘅意義，因為咧佢會咧開始一有將呢個定性為係一個呢個咁嘅事件之後咧，一連串嘅會議會產生啦，亦都會咧去探討究竟點樣能夠用國際嘅唔同嘅國家嘅方法咧去控制呢個疫情。咁特別咧係講到咧喺呢個會議當中係講到咧，究竟我哋點樣可以做一個研發嘅藍圖去對抗呢個新型嘅冠狀病毒。咁而家係講緊新冠嘅肺炎嘅病毒啦。究竟點可以控制得到佢哋？其中喺因為呢個嘅國際事件關注事件開始確認之後咧，就引起一串嘅會議啦。咁喺2月中嘅時候咧，咁咧其實有一個國際性嘅會議咧，就係咧喺唔同嘅國家嘅專家或者係無論係科研嘅啦，或者係公共衛生嘅專家咧，都係一齊咧去開一個大會，去確認究竟我哋有需要有啲乜嘢要去做，以至能夠可以控制到呢個疫情。咁其中咧，我哋就知道咧，就講到咧，就係話其實大部分嘅專家咧，都係有一個共識，就係話我哋需要咧去立即去研發一啲第一譬如話係呢個測試嘅試劑啦，一啲藥物嘅用啦嘅使用啦，疫苗嘅使用啦，以至咧可以咧能夠控制到呢一個嘅病情或者係呢個爆發。特別係講到咧呢啲咁嘅使用咧係能夠咧係可以好快咁樣可以俾唔同嘅國家或者市民咧可以去用得到，以至咧可以將嗰個疫情嗰個危機咧降低。咁喺呢個前提之下咧，咁當然啦，我哋知道係有呢個疫苗，可能係一個好好嘅方法去控制呢個新冠疫苗新冠嘅病毒嘅爆發啦嘅全球性嘅大型流行啦。咁但係我哋要做呢個疫苗嘅時候咧，我哋嘅前提就係話，我哋過去嘅時候咧係做呢個疫苗係需要好長嘅時間咧去做一個科研嘅發展，以至能夠證明到佢係能夠喺安全咁人裏面使用㗎。咁我哋講緊咧，一般嘅疫苗嘅研發咧係講緊10年或者以上嘅。譬如話初期嘅時候，可能用3至8年嘅時候咧，去喺實驗室當中睇下嗰個研發，睇下有冇可以適合嘅方法去製造呢個疫苗啦。跟住喺動物身上邊去使用啦，譬如話喺老鼠或者係一啲馬騮或者猴科嘅動物咧裏邊使用，究竟睇下佢嘅安全性同埋佢效用性有幾高。咁喺一連串呢啲喺實驗室裏邊做得好嘅報告嘅時候，佢哋就會去到一個臨床嘅階段啦。咁臨床階段就係有第1期啦、第2期啦、第3期啦。咁你睇到咧呢個嘅人數咧喺每一期裏邊咧，其實都係唔同嘅。喺初期嘅時候，第1期嘅臨床測試嘅時候咧，係講緊大概10幾個人或者係幾十個人咧去做呢個測試。咁個目的就係話注射呢啲咁嘅疫苗實驗嘅疫苗咧，去呢啲人當中睇下究竟佢嘅安全度有幾高。通常都係講緊會唔會有啲好不良嘅嚴重反應啦。甚至咧最嚴重嘅可能會死亡啦。咁通常都係個目的就係睇下個安全性有幾高，跟住就會去到第2個階段啦。第2個階段可能就會睇下同樣會注意下安全性有幾高啦。但係我哋用嘅人數咧係相對嚟講咧會多好多，講緊幾百人或者以上。到嗰陣時候我哋可能會有啲細分啦，就可能會有啲人咧接受一啲高劑量、有啲中劑量或者唔同嘅劑量嘅實驗性嘅疫苗，睇下佢嘅免疫反應有幾高。 以至咧再去判斷我哋究竟應該點樣使用呢啲疫苗，譬如話嘅劑量啦，要打幾多次啦，都會喺呢段時間咧去做一啲初定嘅嘅立案嘅。跟住啦，去到真係成功嘅話，係安全，而且發覺佢免疫反應係良好嘅時候咧，我哋就會去第3期嘅測試。咁講緊係1000人或者以上，咁甚至過萬嘅，咁就會係睇下佢嘅安全性啦、有效度啦，同埋咧真正咧佢嘅保護作用有幾高咁到時候當通過呢3個嘅時候咧嘅測試嘅時候咧，就會去到一個監管機構咧去做一個咧審查啦。咁當呢個審查係做得好，係 pass 嘅話咧，佢就能夠喺商業嘅運作裏邊可以使用講緊呢啲情況咧，就係一般以前係講緊10年或者以上，係過去最成功嘅例子就係伊波拉嘅爆發時喺2014年咧，喺5年之內咧，喺2019年就已經能夠可以做一個商用嘅伊波拉嘅疫苗係使用嘅咁所以咧喺呢個咁嘅前提之下咧，今次嘅新冠疫苗嘅研發咧係講緊1年我哋講緊1月頭開始見到佢真係有嚴重嘅爆發，2020年去到2020年嘅12月嗰陣時候咧，就有一個初步嘅呢個疫苗嘅可以喺市民上邊去測試或者使用嘅。咁講緊1年嘅時間去做呢樣嘢，咁其實咧係一個史無前例嘅情況嚟嘅。嗱，咁究竟呢個世衛係講咗話有一個嘅疫苗嘅指標啊？咁究竟呢個疫苗嘅指標係有幾高咧？嗱，咁因為咧有唔同嘅情況之下咧，亦都有唔同嘅前設或者係假設，所以我而家今次咧就會講緊一個最低限度嘅 standard 嘅指標咁呢個係最低，就並唔係話而家現有嘅疫苗咧係只係得呢一個嘅程度，而只不過呢個咧係話喺嗰陣時嗰刻，我哋未有任何疫苗嘅情況之下，我哋最低嘅期望係幾高，而且有呢個期望之後，我哋先至會使用呢啲咁嘅病毒嘅疫苗咧，去保護我哋嘅。嗱，咁喺嗰陣時候咧，我哋嗰陣時候世衛咧就有2個前設，就係話喺一個爆發嘅情況之下，即係可能講喺局部地區嘅爆發啦，但係或者係講緊一個長期嘅使用嘅情況。咁而家咧因為新冠病毒咧已經係咧喺全球係長期咁揾到啦，咁所以我而家呢刻我哋都可能着重係呢一個地方，就係 long term use 長期嘅運作。咁佢哋嘅究竟佢哋想嘅疫苗嘅有咩特點咧？咁就係佢可以打咗落人嘅身體上邊咧，喺一啲 at risk 嘅 person， 即係有機會被感染嘅人嘅當中咧，佢哋嘅能夠有保護嘅作用咁咧佢嘅主要嘅針對嘅對象咧就係咧。可以係有成人，甚至係一啲年長嘅長者。當然啦，都會有禁忌啦，就係咧話會有啲人咧係唔能夠咧使用呢啲疫苗嘅。譬如話一啲對免疫有缺陷嘅人啦，或者佢免疫有可能有因為藥物嘅關係，而且佢免疫嘅反應係唔良好嘅時候咧，我哋呢啲咁嘅人咧，雖然佢係成年人或者佢長者，但係我哋都唔會建議佢哋使用。所以我哋喺呢個前提之下咧，我哋係會會 expect 咧係有一啲成年人咧係唔能夠適合打呢個疫苗嘅，咁當然啦，我哋都希望呢個係一個好好嘅安全嘅疫苗啦。咁我哋希望佢嘅疫苗嘅效益咧係遠高於嗰個安全嘅風險嘅，即係打完之後保護嘅作用係永遠多過我哋打咗之後會有啲副作用嘅情況咁而且咧，我哋唔希望咧有一個嚴重嘅不良嘅反應係因為呢個疫苗咧去產生咗嘅。咁而佢究竟我哋世衛希望嘅最少嘅保護作用幾多咧？係有50%即係打咗50%嘅人，即係打咗呢個疫苗嘅人咧，有50%嘅人咧係能夠受到保護嘅。咁而我哋係會知道咧呢啲咁嘅疫苗咧，可能需要咧打超過1劑甚至可能要多過2劑或者3劑甚至好似流感情況之下咧，可能會一段時間再打一個 booster， 即係再增加我哋嘅免疫反應，以至維持到一個良好嘅抗病毒嘅情況。咁佢嘅保護嘅作用，期望嘅時間咧，係最少能夠保護到6個月或者以上。佢能夠接受到嘅疫苗注射嘅方法咧，我哋無論咩方法都會接受得到。可能講緊係打手臂打肌肉打皮下脂肪或者係甚至係用呢個 噴鼻式嘅方法都會接受得到。我哋都係嗰陣時候前設就話，只要一個好疫苗，佢無論用咩方法去打嘅話咧，都係會係一個接受到嗰個方案嚟嘅。咁佢嘅儲存咧就希望佢能夠喺-20度之下咧，可以長期度穩定，可以長期可以使用嘅情況之下。咁咧，而且最重要嘅就係呢點啦，就係咧希望能夠咧能夠大量咁樣製造，而且咧係一個俾到一啲唔同國家，無論經濟任何情況啦，佢哋嘅地方啦，都能夠咧可以使用到呢啲疫苗。個目的就係話希望我哋全世界都能夠咧，大部分嘅人咧都能夠可以接受到呢個疫苗嘅好處。咁當然啦，我哋因為頭先講過啦，我哋呢個係一個好趕急嘅情況之下去再做呢疫苗嘅，咁所以我呢個係一個緊急嘅危機嘅使用。咁就可能會冇一啲嘅前設咧，就係話有啲咁嘅前設咧，就係話個監管嘅檢查咧係會比較快，而且咧又未必需要一啲好大量嘅數據咧，都會咧可以俾佢使用到喺人身上邊。好啦，咁嗱，我哋頭先Angela 就講過而家有唔同嘅疫苗喺已經市場上邊可以喺使用啦。咁究竟全世界究竟有幾多人係使用咗嘅咧？咁而呢一個係一個唔係最 update 嘅情況啦，係5日之前嘅情況，就係全世界究竟有幾多人咧係打咗1劑或者以上嘅新冠疫苗嘅情況。咁就係講緊，譬如話一啲地方，譬如話中國或者香港，講緊大概5%，香港而家可能講緊6至7%度啦。咁係打咗1劑或者以上嘅。咁譬如話美國係講大概40%啦，英國講緊大約40%。最犀利就係呢個以色列啦。以色列你講緊100%嘅人咧係咧有打咗呢個新冠疫苗，打咗1劑以上。其實最新嘅數據咧就係講緊，其實大部分嘅人咧係50%嘅人咧，以色列嘅人咧係已經打咗2劑㗎啦。咁其實咧講嘅數量咧喺全世界咧係已經有400個 million 嘅 doses 係已經用咗喺人身上邊㗎啦。咁而家講緊咧香港咧就講緊38萬度。咁就遠比咧呢個數字咧，同其他國家比嘅話咧，某啲國家比嘅時候咧，係比較唔係太理想。我哋亦都建議市民咧去盡量去接種。咁當然啦，有幾多問題就嚟啦。究竟係咪保護到㗎？會唔會有其他情況啊？咁樣咧呢一個以色列頭先講過大概有100%嘅人咧已經打咗1劑以上啦。咁我哋睇下佢嘅數據咯。其實呢個數據就係講緊大概有50萬、60萬人咧。係打咗疫苗，60萬人嘅數一個參考嘅數據，咁喺唔同嘅年齡層咧，去搜集嘅資料，睇下佢哋有打咗之後，佢嘅保護作用有幾高。咁嗱，呢個就係講緊佢嘅受感染嘅率啦、發病率啦、入醫院嘅情況啦、嚴重嘅病徵啦。你睇到咧，打咗1針之後咧 ，day 0就打咗1針 ，day 10、21咧，即係21日之後咧就打第2針。你見到初頭嗰陣時候咧，其實嗰個打咗針同冇打針嘅數據咧，其實冇乜大嘅分別，直至到去到第12日度啦，開始你見到咧打咗針嘅人咧，第一針嘅人咧已經開始會個數量已經減低咗啦，比相對嚟講比冇打針嘅咧係開始減慢，以至咧去到最尾咧係緊緩緩咁樣上升。咁呢個講到咩嘢話？打咗第1針咧個保護作用初頭係冇咁高。但係開始到第2個禮拜度咧，開始見到有免疫反應開始出嚟，咁所以打第1針咧，唔能夠完全保護到你哋，呢個係一個大家要明白嘅信息。第2個信息就係話咧，打完第2針之後咧，嗰保護作用咧，其實係非常之良好嘅，大概90%以上咧，喺呢啲咁嘅情況之下，病徵啦，有冇感染啦，有冇入醫院啦，有冇呢個嚴重嘅病徵，甚至死亡咧，其實嗰個保護作用咧係超過90%嘅。咁但係仲有一樣嘢就係話咧，佢哋唔係呢啲情況之下咧，唔係完全零嘅，即係佢哋仲會有個別嘅人咧係會感染到嘅，所以疫苗唔能夠100% 保護到所有嘅打咗疫苗嘅人，但係大部分嘅人講緊90%或者以上咧，喺呢一個實驗當中咧，係能夠睇到佢顯著嘅保護作用，而且當中咧係一啲好年長嘅人，譬如話60歲或者以上嘅，講緊有10幾萬。好啦，第2樣嘢啦，打咗1針係頭先我講話會受感染啊，但係其實都唔係完全冇用。頭先打咗第1針之後，講緊第21日之後先再打第2針啊嘛。你見到咧，如果第1針之後感染咗嘅時候，佢哋嘅病毒嘅數量咧 喺初期如果感染嘅話咧，佢哋會高嘅。但係譬如話喺第2個禮拜先被感染嘅話咧，你見到呢個病毒數量咧，其實係已經減低咗好多㗎啦。咁有咩好處啊？病毒嘅數量喺身體上減低咗嘅時候，第一，嚴重發病嘅個案咧，相對嚟講會減少。第二，因為嗰個人有呢個控制到個病情嘅時候咧，佢個病毒嘅數量減低嘅時候咧，佢就冇咁容易即係將呢個病毒咧傳染俾其他人。咁所以係一定嘅，其他人亦都有相對嚟講有保護作用，得益㗎。好啦，咁跟住啦，咁就呢個頭先講到有香港而家現行咧有2隻嘅疫苗可以使用啦，就係 Sinovac 同埋 bioengineering 啦，就係 mRNA vaccines 同埋呢個滅活嘅疫苗啦。佢哋有唔同嘅副作用我建議大家咧都去真係認真睇下，究竟佢哋嘅副作用有啲咩唔同以至咧個人去做一個取捨，邊一隻疫苗係比較好啲，係適合你啲嘅我諗2隻都係一個我哋建議會使用嘅疫苗因為佢哋真係有一個保護嘅作用喺裏邊。咁當然啦，好多人會講啦，就話呢個 mRNA 嘅疫苗咧，可能個副作用相對嚟講比較高。其實可能講緊係話，譬如話發燒啦、發冷啦呢個情況咧，係多過1成嘅人會有嗰個情況出現。相對嚟講咧，呢個滅活疫苗咧，佢發燒嘅個案咧係講緊咧0.1至1%，即係可能少過100個人裏邊有1個人咁嘅情況咁嚴重嘅情況之下咧譬如話罕見嘅就係話，譬如有面部下垂有啲面癱嘅情況，咁講緊1000個裏邊咧有1個或者以下而呢度咧就比較罕見嘅咧，都係講緊一啲即係好少嘅輕微嘅病徵，譬如話講緊腹瀉打嗝結膜充血，即係呢啲病徵副作用咧，相對嚟講係比較輕微嘅。但係我最想強調嘅就係話咧，過去咁多個人頭先講400萬幾百萬嘅人咧打咗幾億嘅劑數咧打咗嘅時候咧，都咧其實未有一個好直接嘅證據咧，係講緊咧佢哋一啲好嚴重嘅副作用，甚至引起死亡而家係過去係咁多個情況之下，係冇一個健康人身體上面咧打咗疫苗咧有呢個咁嘅情況出現呢個數據係講緊唔係淨係講香港，係講全世界唔同國家打咗疫苗之後，佢哋都冇一個好有力嘅證據話係對呢個病毒咧呢個疫苗咧係對呢啲咁嘅打咗健康身體打咗人咧有一個咁不良嘅反應。好啦，跟住第二樣嘢就話呢個保護作用有幾耐啦？其實我哋而家呢刻咧，我哋都唔能夠講到話你聽咧個保護作用係有幾高。打2劑之後會點樣會唔會保護1年半年而家我哋仲係一個研究當中，因為尋日真係未試過發生。但係我哋睇到過去我哋感染咗嘅人咧，佢哋嘅病毒感染咗之後，佢哋康復咗之後，佢嘅病毒嘅抗體咧就開始會隨着年日咧減低嘅。講緊100-200日之後咧，佢嘅數量嘅病毒抗體嘅數量開始會降低啦。咁而且咧有啲個案咧就睇到話被感染嘅機會咧係再被感染機會咧係發生過嘅。咁所以咧我哋都係建議即係感染咗啲人咧，長遠之後咧都可能需要再打呢個疫苗咧去保護自己。好啦，跟住到最後啦，就係講緊咧呢啲咁嘅疫苗咧打咗之後咧，其實未感染嘅當然會產生抗體啦。感染咗之後咧，再打疫苗咧，其實佢嘅抗體數量亦都會增加。咁所以頭先講到啦，呢個病毒咧感染咗之後，佢病人咧會減低呢個抗體嘅數量，隨着年日減低。所以可能到呢時候咧，我哋就需要打呢個加強劑，就打呢個疫苗，將呢個病毒抗體咧提翻升去，以至咧產生呢個免疫嘅反應。好啦，到另一個問題就係話咧，而家聽到可能各個國家咧都講緊話，病毒會變異喎，會唔會呢疫苗係失去效力啊？咁其實咧個病毒咧由開始至而家咧係不斷咁變異，因為佢係一個 RNA 嘅病毒，咁係變異咧係一個好正常嘅事。呢個就係講緊呢個圖譜咧，就係講緊呢個病毒變異嘅圖譜啦。喺全世界由2002年嘅2月咧到而家，佢嘅病毒咧變異係你見到係好多唔同嘅變異嘅。咁所以咧係一個好正常嘅事。咁其中有一啲變異咧，譬如話我哋知道有啲叫 variant concern 咧，就係501Y、V1、V2 同 V3，即係講英國、南非同埋巴西揾到嘅一啲嘅變異體。咁佢哋咧就懷疑佢哋會對呢個病毒嘅疫苗咧係有一啲免疫嘅即係會抗拒嘅反應。咁而家呢刻嘅話咧，我哋都係做緊研究，究竟睇下究竟而家現有嘅疫苗咧，會 會唔會係一個對呢啲變異體係失效嘅？嗱，咁而家我哋有啲數據咧就知道，譬如話 mRNA 嘅疫苗咧係咧對呢啲變異體咧大部分都係一個有一定嘅效用但係咧阿斯利康咧對某一啲部分嘅，譬如話講緊呢個巴西嘅情況咧，就發覺咧佢可能咧未必有咁高嘅保護作用咁而呢個新科疫苗咧，而家未一個好強烈嘅數據咧，去話咗俾我哋聽究竟嘅保護作用係幾高。但係無論都好，呢個病毒咧其實全世界有唔同嘅種類所以如果個病毒嘅疫苗咧係唔能夠保護一樣嘅話咧，就唔係代表佢哋唔會保護到其他嘅咁所以咧係相對嚟講係一個增加咗你避免感染嘅情況嘅。所以我哋都建議咧，無論點嘅情況之下，都會建議你打咗疫苗，去減低就唔同種類嘅病毒咧感染嘅風險。咁當然啦，我哋一個頭先知道係有啲疫苗可能未必對呢變異體會全部有好嘅反應。咁但係我哋都要明白，我哋唔係真係一個完美嘅世界當中，我哋亦都唔能夠咧無限量咁樣等一段好長嘅時間等一個完美嘅疫苗去出現咁我哋過去喺用譬如話用流感嘅疫苗啦，其實我哋用咗咁多年，我哋知道咧個病毒呢個疫苗咧，其實嗰個保護率亦都唔係真係非常之高嘅。喺好嘅時候，我哋講緊有80%嘅保護率；唔好嘅時候有2成嘅保護率但係咧，我哋知道咧，佢嘅保護作用咧係非常之高嘅譬如話喺2015年、2016年咧個病毒嘅疫苗咧個保護率大概5成啦，但係經過數據咧係喺美國數據咧睇到能夠咧避免咗500萬嘅人咧避免感染咗呢個流感嘅病毒嘅感染嘅。咁所以咧呢啲咁嘅疫苗咧，其實係能夠減低傳播、減低被感染、減低死亡、減低有嚴重病徵嘅情況咁過去2019年咧，世衛咧就統計咧，大概每年咧有0.5個 million 嘅50萬嘅人咧係因為呢個流感病毒感染而死亡你諗下，新冠肺炎講緊而家呢刻大概已經知道有2.7個 million 嘅人咧係因為咧呢個新冠病毒咧以致死亡嘅，係講緊大概2% 嘅全世界嘅人咧係受到呢個病毒嘅感染咁你諗下，定其他98% 嘅人咧都仲可能有機會俾呢個病毒咧去感染嘅，所以其實對全世界嘅人類咧係一個仲係好高嘅危機裏邊，好高嘅風險，對人咧係一個好大嘅威脅。咁當然啦，我哋希望咧就不久嘅將來咧，我哋能夠咧繼續有啲新嘅即係新冠肺炎嘅病毒嘅疫苗發現啦或者生產啦。其實而家咧已經有83種咧，仲係喺呢個 clinical development 喺臨床測試當中嘅咁咧另外仲有咧100多種甚至200多種咧喺實驗嘅情況之下咧係而家做緊研究嘅。咁我哋估計將來會有更加好、更加完善嘅疫苗會出現，但係呢個時間幾時咧，我哋都未能夠完全推薦得到。咁所以呢刻嘅話咧，有一啲可以保護到我哋嘅疫苗嘅時候咧，我哋強烈建議咧佢哋去使用。好啦，最後我都希望你哋明白究竟我哋世衛點樣推薦呢咁嘅疫苗佢嘅保護作用有幾高。我哋都希望大家咧去相信咧一個科學嘅數據，希望能夠咧可以俾大部分人咧接受到呢個資訊之後咧，佢哋去接受呢個疫苗嘅注射。多謝。
多謝潘教授嘅分享。如果你哋咧有任何嘅問題想發問嘅話咧，你哋可以將相關嘅問題咧透過聊天室嗰度發送到去名為 Q&A 嗰個帳號，喺嗰個問答環節咧，我就會代為提問㗎啦。咁潘教授之後咧，我哋有 Professor Cowling， 佢會以英語去分享嘅。After Professor Leo Poon's sharing, may I now invite Professor Benjamin Cowling? Professor Cowling will speak in English. Professor Cowling, please.
Thanks, Anderson. My pleasure to share some thoughts about the way forward with vaccination and also the possibility of herd immunity. The past year, we've seen an incredible spread of COVID around the world. But one thing that really stands out to me when I look at where all the cases have been reported is the lack of infections, the low incidence in the Asia-Pacific region, including China, Hong Kong, and Southeast Asia, Cambodia, Vietnam, and so on, and Australia, New Zealand. Really, compared to other parts of the world, we've done very, very well so far in minimizing the spread of infections, minimizing the impact of COVID-19 on public health. Now in Hong Kong, I think we're hoping for elimination, at least temporary elimination of COVID-19 in the same way that's been achieved in mainland China, in Taiwan, in Australia, and New Zealand. And so in order to achieve that, there's two parts. The first part is getting the case numbers down to 0. And then the second part is staying at 0. And other places in Asia Pacific have managed to achieve that. In Hong Kong, we've managed to get case numbers down to 0 after the second wave, after the third wave. And I just heard maybe today we're going to have 0 local cases for the first time for quite a while. So that's great news. Getting numbers down to 0 has been difficult. Each time we've had community outbreaks, we've needed to implement some social distancing measures in addition to the face masks that we've been wearing for more than a year and the contact tracing and quarantine and so on. So we've managed to get down to 0. And then in order to stay at 0, one of the key parts of that is the quarantine on people who come into Hong Kong from outside. If we get to 0 locally, then we've got rid of the infection locally. The way that it's going to get back into Hong Kong is from outside. So requiring everybody who comes into the city to go into quarantine for maybe 14 days, maybe 21 days is really, really essential to succeeding in an elimination strategy. Of course, if infection does find its way in, we'll have to get the numbers back down to 0 again. And we've seen in the mainland, they've done that. In Taiwan, they've done that. In New Zealand and Australia, that's happened a number of times. And in Hong Kong, we can expect that might happen in the coming months. But I think we can achieve this. At the same time, if there are other parts of the world, mainland China, Australia, New Zealand, Taiwan, which currently have 0 cases, then maybe we don't need a quarantine for people coming from there because there's no risk that they're going to bring infection into the city. But in general, the quarantine is a really critical part of elimination. Now, our team at the University of Hong Kong has been tracking the reproductive number over time, looking at the ups and downs in this reproductive number. And this R value represents the average number of people infected by a case. So if the R value is 2, it means on average, every case is infecting 2 more people. And if we have a period of time when the reproductive number is above 1, then that would correspond to a general increase in case numbers. And if we have a period of time when the reproductive number is below 1, that would correspond to a general decrease in case numbers over that period. So we can track the RT, the reproductive number over time. So that's R over T, RT. We can also imagine what might be the value of R if we weren't doing anything, if there was no immunity in the population. And for somewhere like Hong Kong, it's probably around 3. Right at the start of the top panel on the left-hand side, the R value started at 2.5, but we already had some measures in place even then. People were wearing some masks. We were a little bit cautious about COVID, even back in January of 2020. So my estimate is probably R0 is somewhere around 3. And we see in November, the RT did hit 3. Actually, in June and July, it went even above 3 for a very short period of time. Now, because of the occasional surges in community transmission, we've had to use social distancing measures to get the case numbers back down to a low level. At the top of this slide, you can see we've had very good use of face masks for more than a year. We've had almost universal masking since February of 2020. And the government's also been doing a very good job of test and trace. That's the targeted measure to isolate cases once they're identified, to trace their contacts, and the contacts go to quarantine. And those targeted measures are really, really important in allowing us to limit transmission. But those measures, although they've been applied throughout the past year, haven't been enough to stop the second wave, the third wave, and the fourth wave. We've had to bring in social distancing measures. Some of them are listed on the left-hand side of this slide, reducing the mass gatherings, asking civil servants to work at home, and then other private businesses also follow along and also advise their staff to work at home. Closure of bars, nightclubs, karaoke, leisure facilities, the restaurant measures, and also school closures. And those package of social distancing measures have been applied in March, in June, July, in November, December, January. And each time they've been implemented, that's corresponded to a major drop in the reproductive number, and the case numbers have started to come down again back towards 0. So we've needed those measures, those social distancing measures, and we're going to continue to need them if there's a resurgence in case numbers again, if we have a fifth wave, we will need social distancing measures again, most likely to control that fifth wave or even subsequent waves after that. But there's a way out of the use of social distancing measures if we could replace it with the use of vaccines instead. So the use of vaccines, as we've heard from the previous two talks, they're highly effective and they provide us with a pathway back to the normal life we had in 2018 or 2019. We wouldn't need face masks. We wouldn't need the social distancing policies. We wouldn't need the quarantines anymore if we can replace all of that with vaccination to get us a high level of immunity in our population. Until that time, at the moment, the status quo is that any surge in COVID-19 transmission would really be a major threat to the healthcare system and could cause a lot of serious infections, even a lot of deaths, unfortunately. We've seen so far in the past year 200 deaths from COVID, and we've been one of the most successful places in the world in controlling COVID. And so if we have another surge in cases, we would expect that there will be health impact of that, and we can't allow that to happen. So until we replace the public health measures with vaccination, we're going to still need the social distancing measures from time to time. So how can we use the vaccines that we have? There's a general theory about how vaccines work. And firstly, I can show on this slide the idea of infection and disease. So when there's an infection spreading in the community, some people will be infected, and then a minority of the infected people will get particularly sick from that infection. That's certainly true with COVID-19. When COVID-19 is in the community, some people get infected. Majority of the time, the infection is very mild, and a minority of the time, the infection's more serious. In other parts of the world, maybe 1 in every 20 infections, 1 in every 20 people who are infected would need to go into hospital. And the fatality rate, the mortality rate per infection is something like 1 in every 200 infections, something like that. So COVID-19 is a nasty infection. It could be a nasty disease. Some vaccines for diseases in general and for COVID specifically could be good at reducing the risk of an infection occurring. And so they make the person immune to infection. If you can't get infected, you certainly can't get sick if you can't even get infected. So that's really good news for vaccines that can stop infections. And then we also have the possibility with some vaccines for some diseases and also for COVID-19, that a vaccine could limit the disease progression, even if a vaccinated person gets infected. And so that's good news for the vaccinated person, that even if they were to get infected, their disease maybe wouldn't be so serious. It would be limited to a mild disease, maybe a disease without even any symptoms. So that would be a kind of vaccine that limits the disease. Now, for all the different infections that we have vaccines for, sometimes vaccines are very good at stopping infection, and sometimes vaccines are very good at limiting disease, even if they don't stop infection. And some vaccines do both. For COVID-19, all the vaccines that we know about look like they're very successful in limiting disease and will have a very high efficacy against severe disease. And that's true for BioNTech, that's true for Sinovac that we use in Hong Kong. But then for the COVID-19 vaccines that are available in different parts of the world, some of them are better than others at limiting the risk of infection. Some vaccines allow people to have a mild infection. Other vaccines seem to stop even mild infections quite effectively. So there's two kind of strategies that are used in public health with vaccines. One strategy that's used in public health is to limit disease. And the idea of vaccination in that kind of approach and that kind of strategy is to vaccinate everybody who's at risk of severe disease. Now, we use that for flu. We've been using that strategy for flu in previous years, and other places in the world use that for flu. So the idea is maybe vaccinate elderly who are at particular risk of severe disease from flu, and then healthy adults, maybe younger adults, maybe they can choose whether to get flu vaccination or not, but they're not at particular risk of severe disease. Now, if we think about this strategy for COVID-19, actually, we'd probably want to give vaccination to everybody because COVID-19 can be serious in all age groups. It can even be serious in children sometimes. It's rarely serious in children, but sometimes it can be serious in children. So if we're going to follow this strategy, we'd need to get as high vaccine coverage as possible. And even if infections were to spread among vaccinated people, even if infections spread among unvaccinated people, the public health impact would be much lower than if we were not using vaccines. Now, one of the limitations with this kind of strategy is there's always some people who can't get vaccinated, like in Hong Kong with COVID-19, people with serious allergies, and right now pregnant women and right now children, but later maybe those groups would be able to be vaccinated. There's also going to be some people in whom the vaccine doesn't work that well. So maybe people who are very old and frail, maybe people with weak immune systems because of some chronic disease, or because maybe they have cancer, they're having chemotherapy, something like that. So in those people in whom vaccination is less effective, or the people who can't receive vaccination, we'd have to think about how to protect those people if we went back to normal. So maybe we'd have to think about shielding them in some way with maybe still being strict about visitors to elderly homes, maybe some other measures, because otherwise we'd worry about infections in those really vulnerable people who can't be vaccinated. The second strategy that we can think about with vaccines is herd immunity. And that's really the preferred choice in many parts of the world that are thinking about using COVID vaccines. And the idea, the concept of herd immunity, is that if you have enough people in the population that are immune to infection, then infection won't be able to spread. So on the left-hand side, you can see an infected person's able to spread to a number of other people around them. On the right-hand side, the yellow infected person really can't spread infection very far when there are more immune people in the population. And so the concept of herd immunity is having enough immunity in the population that infections will no longer spread. We can get herd immunity naturally if we have a large enough epidemic, and actually every winter we have a flu season, and the reason that the flu season comes to an end is because we've hit herd immunity, and so there's not enough susceptible people anymore for the infection to spread to. But for COVID-19, we would really prefer not to get herd immunity naturally, because there'd be so many infections, so many serious infections on the way there. It would really be a major problem for public health. So how can we get to herd immunity through vaccination? We'd need a high coverage of vaccines that prevent contagious infection. So actually, for herd immunity, the critical thing is that people can't get infected, or at least even if they do get infected, they can't further pass on infection to anyone else. So that's similar to needing vaccines that prevent infection, but we'd be okay if vaccines don't exactly prevent infection, but at least they prevent an infection that can be contagious to others around. And so some vaccines are probably better than others at preventing contagious infection. We've heard some early data from Israel where the BioNTech vaccine seems to be highly effective in preventing contagious infections, maybe more than 90% effective in that. And there's no threshold for how many people would need to be vaccinated to get to herd immunity. It's not something that we can calculate really, really precisely, but a rough estimate, a rule of thumb, is something like 1 minus 1 over R0. And I said earlier, maybe R0 in Hong Kong could be around 3, and that would mean a herd immunity threshold would be around 67%. So we need about 2/3 of the population to be immune if we wanted to get herd immunity. Even if we didn't get to 67%, as long as the immunity level was higher, towards 67%, we'd be able to slow down the spread of infection and have time to respond to any outbreaks that do occur, any transmission in the community that does occur. And of course, the people who've been vaccinated, even if it's less than 67% immune, the people that have been vaccinated would be protected against severe disease. So herd immunity, really the advantage and the attraction of herd immunity is that everybody can be protected, not only those who've been vaccinated, but everybody else as well. And I mentioned before that there's always going to be some people who can't receive vaccination and some people in whom the vaccines don't work as well. So if we'd like to get to that level that I estimate would be maybe 67% of the population to be immune, then we'd probably need to get at least 70% of the population to be vaccinated if we had a highly effective vaccine. And so you can work out what kind of vaccine coverage you'd need based on the effectiveness. And I mentioned before that the BioNTech effectiveness is likely to be more than 90%, maybe up to 95% against contagious infection. So really a high coverage, particularly with highly effective vaccines, would be our pathway to herd immunity, and then everything could be relaxed. One of the issues that we're going to have to face in Hong Kong, though, is the relative limited enthusiasm so far for vaccination. We've been tracking this through time in telephone surveys in Hong Kong, going back to last summer, actually, asking people if vaccines are available, would they consider to get it, would they intend to get it? And then plotted here is the track over time. You can see a blip in early to mid-March, a sudden drop down in the intention, and then it's come back up again in our most recent survey to around about 50%. So if we just projected based on this, we might estimate that about half the population could get vaccinated. We'd like that to go up more and more and more, maybe as people get more confident about how well vaccines are working, how effective they are, and how much of a good idea it is for individuals and for the community, if as many people as possible do choose to get vaccinated. And hesitancy varies by age. So one of the questions we've been asking in our surveys is how you'd consider about getting vaccination. On the right-hand side here, we've got the blue area is people that are saying they'll choose to get the vaccine as soon as they can, regardless of what anyone else is doing. On the left-hand side in orange, this is people who are choosing not to get vaccinated. And then in the middle is the green. These are people who are hesitant about vaccinating, maybe waiting to see what's going to happen. And that's the majority so far of people in Hong Kong, particularly in the younger age groups. There's a lot of area which is colored green. Now, looking forwards, I wrote a couple of commentaries. One was in Chinese, in Mingpao. One is in English, published a bit more recently in Citizen News. The links are at the bottom. If you search my name, you probably be able to find it. I talked about the three possible strategies. One of them is suppress and lift, meaning when case numbers go up, we'll need social distancing. When case numbers come down again, we can relax a little bit. And eventually we'll get to herd immunity, either by vaccination or by natural infections. And this is the strategy that you can see in Europe, maybe in the United States as well. They're going to get to herd immunity probably this summer through a combination of vaccinations and natural infections. The second strategy, which is probably what will happen in the mainland, what will happen in Taiwan, in Australia, New Zealand, and Singapore, is aiming for elimination. That means getting the case numbers to zero and keeping them at zero until we get to herd immunity through vaccination. And that's going to need a high vaccine coverage before it's safe to go back to normal. And then the third one is what we're all looking forward to. That's when it's going to be safe to go back to normal. And so we'll see that probably earlier in the United States and in Europe than in Asia. My suspicion is probably this summer that the United States and Europe will decide to go back to normal. No further restrictions, no further face masks, no further social distancing, no further quarantines, because they're not necessary anymore once herd immunity is reached. In Asia, it may take us a little bit longer to get there. So I'm going to finish this, my last slide, and then we'll be ready for Q&A. COVID-19 is going to remain a major threat to our public health here and to our healthcare system here until we get herd immunity. So in the medium term, we may stick with elimination. That may even be a longer term strategy for us if we can't get up to herd immunity through vaccination. Maybe there's going to be a way to overcome the hesitancy that we've seen so far in Hong Kong with COVID vaccines. One of the issues actually with hesitancy, and written on this slide, is we've had such a low risk of COVID-19. We've only had 11,000 cases in Hong Kong so far in the past year. We've been really, really successful in controlling COVID-19. But that means that a lot of people in Hong Kong maybe don't perceive the risk of COVID-19 because they don't know people that have been infected. They don't know people that have been sick with COVID-19. They don't see a risk to themselves. There was a commentary in the South China Morning Post recently saying someone didn't understand why they should get vaccinated with COVID-19 vaccine because they didn't think COVID posed a risk to them, which is true. It hasn't in the past year because we've done so well with our control measures. But if we want to go back to normal, then vaccination is really the pathway back to normal. And then, as I mentioned in the Mingpao and the Citizen News articles, successful elimination could be a medium-term strategy, particularly if there's insufficient population immunity through vaccination. So that means we may have the status quo for longer, maybe another year or longer here in Hong Kong. So I will finish there and ready for some Q&A. Anderson and Stephanie. Anderson.
Thank you, Professor Cowling, for your sharing. So now is the Q&A section. We have received a very large number of questions. So in the interest of time, we'll try and ask the most popular questions on behalf of our participants. 而家係問答環節，或者我start with 第一條係中文嘅問題啦。呢條問題就係話佢話， 而家本港咧目前就係淨係購入咗3種疫苗。如果咧遲啲或者下年啦要買 booster 嘅話咧，係咪都係要買翻呢3個牌子，抑或都係可以參考最新嘅資料買市面上嘅最有效嘅疫苗咧？ So the first question is about like now Hong Kong has ordered 3 vaccines. If we have to order booster again in future, do we have to order vaccines from the same companies in future? So maybe Leo and Ben, feel free to answer.
喂，或者我講下先啦。咁就而家呢刻嘅話咧，我哋真係強烈建議咧用翻同一隻疫苗咧去打呢個第2劑嘅接種啦。咁但係將來嘅話，會唔會有更加好嘅疫苗，或者係有啲其他疫苗會接種方法會比現家更有理想嘅咧？我諗亦都會咁嘅出現。譬如話而家以前嘅流感嘅疫苗啦，其實都有唔同嘅疫苗。而家我哋每年打嘅流感疫苗都未必一次都一樣嘅。咁所以我會睇到咧，將來如果真係有一個新嘅比較理想嘅新冠疫苗嘅時候，我哋會有去尋求一個比較有效嘅方法。咁當然要睇翻實際嘅數據啦。咁但係而家呢刻嘅話咧，因為我哋嗰個疫苗嘅參考數據亦都唔高，我哋未必能夠咧咁快能夠睇到話第2次或者將來下年或者將來更遠嘅時候會用到啲咩新嘅疫苗去注射咯，係有咁嘅機會喺裏邊。
Anything to add, maybe from Angela, or if not, then we move to the next question. So next question is, will the DNA be integrated into our body? Will it remain in our cells? How safe is the DNA vaccine? So I'm guessing that this is referring to the nucleic acid-based vaccine, not just DNA, but maybe also RNA. 呢條問題係關於嗰啲即係DNA 或者 mRNA 嘅疫苗咧，係會唔會真係 integrate 咗，即係融入咗我哋身體裏邊咧？佢會有冇安全性嘅問題咧？咁或者我哋請 Angela 或者其他專家都一齊去回答。Maybe Angela can start first.
Yes, I will start first. So thank you for the question. Very interesting question. So the general answer is no. The reason is because, as I mentioned in my talk, the pieces of the DNA or RNA being selected for the vaccine are only that of the spike protein, and that part of the viral genome has a very specific function. There are other viruses that exist where a viral infection may cause the pieces of viral genome to be integrated or kind of persist in our own cells or added to our genome. But those viruses require a very specific viral machinery to integrate it into the human genome. So for example, HIV is an example of a virus where parts of the HIV genome may become integrated into the human genome, but it requires a special viral protein called the integrase. Such a protein does not naturally exist in the human body at all. And because in the vaccine, there's no this component which is included in the vaccine, of course, for safety reasons. So therefore, there's virtually no chance that this will happen in the human body. Now, if you search the literature around this, there is one, what we call preprint publication from one research group that claims that they observed some evidence of the COVID-19 natural infection seems to integrate something into the human genome. However, this has not been observed for the vaccine because the vaccine is specifically designed to be quite safe that way. So the answer is no, it cannot be integrated into the human genome.
Thank you. Anything to supplement or add, maybe Leo?
我講英文，你講中文。
或者你可以用廣東話可以講。
我咁睇啦，基本上咧，冇一個實驗嘅數據咧係睇到呢啲咁嘅基因嘅疫苗咧係會引致到咧係我哋人體上面嘅基因有變異嘅。係 so far 係未有發覺嘅。其實提出今次有 mRNA 嘅疫苗係講緊最新一例，但係其實咧過去咧喺禽流感嘅疫苗咧喺人身上面咧係做過臨床嘅測試，嗰陣時候係冇一個證據咧係睇到呢啲咁嘅基因咧係會引入咗我哋身體裏邊咧，以致咧嘅改變咗我哋基因嘅排序。咁所以呢啲係一個冇科學嘅證據而去做嘅假設嚟嘅。咁所以我哋而家係非實驗科學嘅話咧，係我哋覺得係呢啲疫苗咧係冇咁嘅可能。而且或者仲話再講一啲，其實有一啲叫一啲疫苗嘅viral vector， vaccines 啦，嗰啲咧其實咧係已經人工咧去將一啲不必要嘅嘢咧係嘅基因咧係已經去除咗嘅，所以淨化咗嗰個疫苗嘅載體咧，其實咧係一個好安全，係對人咧係基本上係冇乜害處嘅情況之下咧嘅前設咧去注射呢啲咁嘅人身上面當一個疫苗使用，所以整體上咧係我覺得係安全嘅。
好，唔該晒 Leo. Thank you, Angela. Another question that we have is about the vaccination progress. So there are two related questions, so I try to group the two of them. First part is why is Israel so efficient with their vaccination program as compared to other countries? Which vaccines are they receiving? And then a related one to this is why is Hong Kong's vaccination lagging behind other countries? And is there like more specific hesitation in Hong Kong, and how do other countries or cities deal with this issue? 呢個第二條問題就係問點解以色列去接種呢個疫苗嘅進度咁有效率咧？同埋佢哋係用緊邊一隻疫苗咧？香港個情況點解好似比其他嘅地方去注射嘅進度冇咁理想？係咪香港個疫苗嘅猶豫特別嚴重咧？其他國家地方係點樣去處理呢一啲疫苗猶豫嘅咧？ Maybe we can see if Ben can.
Yeah, sure. So Israel had a very smart strategy negotiating with BioNTech to get a lot of doses available very, very early. And in exchange for getting maybe to the front of the queue, they promised to allow access to their medical record system, which is excellent in Israel. It's excellent in Hong Kong as well. It's excellent in Israel. And they said, we'll track everything that happens to people who are vaccinated. So they'll give really early evidence for how effective the vaccine's being in the community. And Leo showed one of the slides from Israel based on that kind of data. And then also they said we'll be able to monitor for any side effects of vaccination, even rare ones, because they've got population level data on what happens to people after vaccination. One of the bottlenecks otherwise, and a bottleneck in Hong Kong, is the supply of doses. So far, we've got probably 2-3 million doses of vaccine in Hong Kong, and that's not yet enough for everybody. So even if everybody wanted to get vaccinated, even if we had the staff available to vaccinate everybody, we wouldn't be able to because of the bottleneck of the supply. In Israel, they got the supply very, very quickly, and then they were able to set up mass vaccination centers like we have in Hong Kong and really get a lot of people through those centers very, very quickly to get up to that herd immunity. So Israel is probably the first place in the world to hit herd immunity with vaccination. Very, very well done to them.
Thank you, Ben. 或者 Leo 有冇啲咩補充可以用廣東話？
我諗我冇乜補充啦，但係當然我就係頭先引述翻阿 Ben 講嘅咧，就係其實佢開初嘅時候咧，已經咧可以同Pfizer 咧，佢哋已經攞咗好大量嘅疫苗咧，去做一個臨床嘅測試啦，亦都可以係證明到即係講明可以當佢哋揾到一啲嘅個案嘅時候，佢哋能夠咧繼續跟蹤住打疫苗嘅個案，以至咧能夠第一時間揾到個保護率。其實呢個咧係一個好好嘅兩個情況啦。第一就係市民係接受到一啲真正科學嘅數據啦，以至咧佢哋一個好理性嘅選擇。第二樣嘢就係政府亦都係好開放，將啲嘅數據咧係公開透明啦，係俾全世界去分享嘅。咁所以咧就係一個好好嘅例子咧，係俾全世界睇到證明到呢個疫苗佢嘅保護作用有幾高啦。
Thank you, Ben and Leo. Another question is it possible or will it be better if we can get more than one type of vaccines or mix the vaccines that we get? Will there be any adverse effect? 另一條問題就係話我哋會唔會如果將唔同嘅疫苗去混合，或者咧接種多於一種嘅疫苗咧，會唔會有啲咩好處或者壞處？咁或者我哋可以睇下 Angela, you have any thoughts on that?
So I'm sure Leo or Ben will have more to add, but basically at this time there has been no study yet to see what the effect of receiving more than one type is. And so we don't know what the safety outcome of that will be. Therefore, it's not smart if you try to sneak into the system to try and get different kinds of vaccines thinking it may protect you. Because as I mentioned, our immune system is actually very sensitive. So we don't know what the response will be if you give it multiple type of stimulation. So that needs to be something that is tested via the clinical trial system that Leo has mentioned before we can make any sort of conclusion about that.
Anything to add, maybe Ben or Leo? If not, then I move on to the next question. Is there anything we should be mindful of after taking the vaccine? For example, do we have to quit drinking alcohol in between the 2 shots, etc.？ 呢條問題就係關於我哋可能注射完疫苗之後有冇啲咩特別嘅嘢需要注意嘅，譬如飲食習慣，咁會唔會係疫苗同接種嘅兩劑嘅之間會唔會唔可以飲酒啊或者其他咁樣咧 ？Maybe we'll start with Leo. Maybe 你可以用廣東話先答。
嗱，我諗咧就一般建議就係希望打咗疫苗之後咧，佢能夠休息啦。咁就我諗初頭嘅時候，其實就希望就唔好做啲劇烈嘅運動啦，就希望因為身體有免疫反應，咁就希望唔會有啲不良嘅加大咗不良嘅情況。但係一般嚟講咧，我哋都見唔到話有咩特別嘅嚴重副作用喺，譬如話呢啲飲酒，其實我哋喺公共衛生嚟講係可能唔建議㗎啦。咁所以咧，無論喺任何情況之下咧，我都唔建議咧大家去即係可能少量都會，大家會可以研議下 OK 啦。咁但係大量我哋都唔建議。其實就一般嚟講，我哋打完疫苗咧，我哋都只係覺得初頭嗰幾日係盡量休息下。跟住情況就一般情況就係話照平常咁生活都已經係可以㗎啦。咁當然啦，如果佢有啲不良嘅免疫反應，譬如話可能過敏啊，咁就盡快去睇醫生。
唔該，Leo. Maybe Ben can supplement a little bit in English as well about any precautions after taking the vaccines.
No particular thing to add. Just remember that you won't be fully protected by the vaccination until 14 days after the second dose. We've had a couple of cases in Hong Kong where people have got COVID after being vaccinated, but that was after their first dose, maybe before the vaccine's really been able to reach its full protective level, before your immune system is able to reach a fully protected level. So that is one thing to be aware of. But
okay, thank you, Leo.
Maybe I want to supplement a bit. So basically, it is quite well known that after the second dose, you will have a much higher chance to get more side effects in terms of fever and headaches. And so just be mindful that you may encounter that scenario, but it is usual. This is somewhat we expect from quite a few people. So this is not abnormal. Over.
And one final point I would add to that is, as I mentioned, some of the vaccines, they try to mimic the effect of an infection, even though your cells are not infected. So if you feel some slight effects from the vaccine, such as the fever, etc., you should just treat like you are having a cold, drink plenty of fluids, and maybe take some multivitamins to help supplement your immune system. You should just treat your discomfort similarly to if you have a small cold or flu kind of discomfort. So that can help if you are experiencing something after the vaccine.
Thank you to all our speakers. The next question was asked in Cantonese. 佢就係近日咧都有啲確診者咧，佢打疫苗之後咧係感染中招嘅。疫苗咧嗰個產生嗰個抗體咧，係咪可以有助嗰啲患者咧去加快佢康復咧？另外啲疫苗咧，如果佢冇經過好多輪嘅認證嘅話咧，而家可以點樣去跟進咧？點樣可以去肯定或者判斷嗰啲副作用係唔係由疫苗去產生嘅咧？ So this question is about some of the conditions that people have observed after taking the vaccines, and so the question is about whether getting vaccinated would help them recover faster, and what is the way to tell whether some of these conditions were really caused by the vaccines or not?
Right, OK， 我而家有3條問題啦。第一個就會打咗針之後會唔會感染啦？嗱，咁有2個原因嘅。第一就係打咗頭先我所講咧，就打第一針之後咧，其實頭嗰個禮拜、頭嗰12日咧，或者2個禮拜係其實都同冇打針嘅人咧受感染嘅危機咧係一樣嘅。就情況就係去到打第二針之後咧，就發覺佢嗰個保護率咧顯著咁樣提升啦。咁所以打咗第一針之後並唔係代表你唔會受感染。 咁所以咧打咗之後，其實都喺初期咧都要做一個自己嘅風險平衡啦。譬如話戴口罩social distancing其實都係一樣要繼續做落去第二個可能咧就係話，其實有啲人咧係打咗疫苗之後咧係冇反應嘅。我哋發覺佢嘅血液嘅血清嘅抗體嘅濃度咧係冇或者係好低嘅。咁呢啲人咧係打咗之後咧係會有機會再被感染，即係被感染嘅風險係喺度嘅。咁但係情況亦都唔高啦。頭先我所講嘅個案係講90%以上嘅人咧係會有呢個好嘅反應嘅。咁所以當然要睇翻個疫苗本身係點樣啦。咁第二啦就係打啲疫苗之後咧就算可能抗體嘅數量低，但係都可能有機會咧保護到佢咧，免至產生一個好嚴重嘅病徵甚至就講到入醫院入 ICU 咁所以咧頭先Professor Cowling 已經講咗咧，佢有幾個層次嘅第一個層次就係避免感染，第二個層次就係避免一個嚴重嘅病徵，甚至去到醫院當中佢 ICU 死亡嘅情況。咁所以有幾個層次，咁個病毒嗰個疫苗嘅層次係對你身上有幾高咧？咁就要好睇個人嘅情況啦。咁但係頭先講過90%以上咧係有一個好嘅反應嘅。咁第三咧就係話疫苗咧喺唔同嘅國家咧嘅世衞其實係唔係一個咧係有權力嘅情況咧，去話邊啲疫苗可以使用嘅，係喺國家嘅層面上面咧去決定邊一啲疫苗可以使用。所以你見到唔同嘅國家都有唔同嘅揀選嘅疫苗嘅情況。咁將來有啲新疫苗嘅時候咧，其實咧都會係要喺唔同嘅政府經過認證、參考嘅數據去睇翻究竟呢個疫苗係咪值得使用，係咪保護作用。咁香港情況係我哋香港嘅監察委員會啦，去睇翻呢啲而家呢刻我哋用嘅疫苗咧係咪值得推薦你使用。將來亦都會咧繼續咧參考啲新嘅數據咧，去睇下以至將來嘅疫苗係咪可以再更進引入嘅。
Anything to add from the other speakers, or if not, then I think we can maybe perhaps move on to the next question. The next question is about the different variants of the COVID-19. So the question is, which vaccine is best at targeting all the different variants of the COVID-19 virus so far? 呢條問題係關於嗰啲唔同嘅變種病毒嘅，而家都可能之前都有提過啦。咁有冇話邊一種疫苗咧係對於所有嘅變種病毒或者大部分嘅變種病毒咧都係相對嚟講比較有效嘅？ So maybe Ben, you want to, and Leo?
Yeah, sure. So we don't have a lot of information because the variants are relatively more recent. The three major variants of concern: the UK, the one first detected in the UK, the one first detected in South Africa, the one first detected in Brazil. We know from laboratory studies that the vaccines, the immunity stimulated by vaccination should be able to provide at least partial protection against those variants, which are only a little bit different from the ordinary virus, maybe the virus that first emerged. But in practice, we don't have a lot of data from real life. Maybe Israel has had a bit of the UK variant, I think, if I remember correctly, and the vaccine seems to be working just about okay. The AstraZeneca vaccine didn't look like it did quite as well against one of the variants from the clinical trial that was done in South Africa, but still provided some protection. So I think we're still waiting for more evidence on how well the vaccines protect against each of the variants. Most likely they'll provide some protection, but a little bit reduced compared to the protection that's been estimated in clinical trials.
Yeah, I think we also want to remind the audience that basically there's different level of protection. So some of them may reduce the chance of having infections. Some of them may reduce the chance of having a severe illness. So the level of protection actually different, but it doesn't mean that there's zero protection. So I think, to me, these vaccines will have some level of protection to no matter which variant we're talking about. Do remember that the virus actually keep on evolving. We will have new variant in the future. So we are basically we expect that there will be a new version of vaccines of COVID, so that we were able to address this variant in the future. But right now we have a partial solution, and we highly recommend that. Over.
Thank you, Leo, and thank you, Ben. So now it's already close to 12:30 p.m., our designated finishing time of the webinar. So unfortunately, because of the interest of time, we cannot answer all the questions, but we really thank all the speakers for their time and sharing their expertise on some of these issues that are very relevant to all of us at this very moment. So this is the end of today's webinar. Thank you very much to all the audience for attending, and special thanks, of course, to our speakers, Professor Angela Wu, Professor Leo Poon, and Professor Benjamin Cowling for their sharings, and also to Dr. Stephanie Ma, also from the University of Hong Kong, who is helping to select some of the questions and supporting us at the back end, and also thank our supporting team, Ada, Amarat, for their support, and to our Hong Kong Young Academy of Science President, Professor Vic Law, for coordinating this seminar. So wish you all a nice and healthy weekend, everyone. 多謝大家參加今日呢一個網絡研討會。我哋由於時間關係，我哋未能夠答所有嘅問題啦，但係都希望大家喺過去嘅1個半小時之內都享受或者認識多少少啦。希望我哋香港可以一齊盡快走出呢個疫情，亦都祝大家有一個健康愉快嘅週末。拜拜。